there are a lot of factors that are responsible for why India is seeing an extremely strong second wave. Uh, but I think the root cause for this would be the fact that the first wave started dying out sometime in September, largely on account of non-pharmaceutical interventions, because we didn't have the vaccine then, and also on account of the fact that a lot of people were getting infected. It's widely accepted that for every 10 infected people, we managed to record one case. Many of the infected people don't even know that they are infected. And there are these surveys that are called seroprevalence surveys that test for immunity in the population, which put the figure of infection at anything between 30% and 50%. And we all know that that gives you some amount of immunity for some limited period of time. 4 to 6 months is what is widely accepted. Um, so we had the first wave, which peaked in September. And since then, the numbers have been coming down. And unfortunately, as the numbers started coming down, people let their guard down. And a variety of things happened. There were a bunch of festivals. There was the big wedding season. And you know how much Indians love their big fat weddings. So there was the wedding season. And several schools reopened. Most activities resumed. We even opened up multiplexes. This is one of the reasons why the cases started going up. But there is a second reason. And the second reason are the mutant strains of the virus. And we don't know enough about it, or we don't know as much about it as we would like to, because we quite honestly are not tracing as many genome sequences as we should be. But from the limited number of genome sequences that we've traced, it looks very likely that the infections, at least in Maharashtra, in Punjab, have been caused by variants. We know that there is one variant which we've seen only here. We have not seen anywhere else, which has got a double mutation, which again is responsible for a lot of cases in Maharashtra. So the big question is, are these variants responsible for the sudden surge of cases? Are the variants responsible for the sudden increase in infectivity? And there again, we don't have scientific answers. But what we do know is that the UK variant, which was traced in the UK, there were enough scientific studies carried out to show that it was actually far more infective, right? I mean, we can't assume that things are great and respond. We have to assume that the worst is upon us and respond. So I think we can safely assume that the variants also had a hand to play. So between the variants and between our own carelessness, and when I say our, it's not just individuals, it's also state governments and the central government. And you know, we are seeing the results. The cases are going up. And the worst thing is it's actually going to impact a recovering economy. And that I think is a price we're all going to have to pay in the months that come. There have been a lot of reports about a unique set of symptoms or an additional set of symptoms that come with the second wave, including, according to at least doctors in 2 large cities in India, conjunctivitis. Not scientifically proven, but they are seeing this relationship. Now, it could just be a correlation. It need not be causation. But it's there. And the other thing we are hearing, anecdotally at least, borne out by data, is the large number of young people, including children, who are getting infected in this phase. And the question that everyone is asking is it because this strain, if it's a new strain, affects young people more? It might be, but there is also a very plausible explanation, which is the first thing that I spoke about. Schools reopen, colleges reopen. Hindustan Times itself has carried a bunch of stories about various IITs and IIMs which have seen a surge in cases because students came back onto campus. Because, you know, in a campus, social distancing is not going to be possible. In a school, I'm not convinced that social distancing works as well as it does in a school. And there is another aspect to it. Research has shown that children are the worst possible spreaders, or actually the best possible spreaders, in terms of efficiency of spreading a disease among any age category, because they travel, they go around the neighborhood, they meet older folks at home, they meet everyone. So it could well be that they are also contributing their little bit to a surge in cases that you're seeing. The overwhelming majority of people like to think that it's less dangerous. It's an explanation that's been proffered by many people, including some in the administration, saying that actually the death rate is still low. And what we have to work with is what's called the case fatality rate. It's the proportion of people dying expressed in terms of or the number of people dying expressed as a proportion of the number of cases, and the whole thing is expressed as a percentage. And if you look at the case fatality rate, it was very high when the pandemic began because no one knew how to treat this disease. And over a period of time, doctors got better of it. So I think if you leave out the first 4-5 months, so if you look at it from October onwards, India's case fatality rate has been around 1.1%. So if you assume that it is 1.1% and you draw a curve which is tracking cases and deaths, and our data analysts at Hindustan Times actually did this, we found out alarmingly that the death rate curve is beginning to increase its gap over the cases curve. Had it been exactly at 1.1%, the two curves would have matched perfectly, but it's beginning to diverge and it's beginning to move up. So it's now around 1.3. And that is worrying. The good news, if it can be called that, is that we know what to do. And the reason we know what to do is because we actually did very well towards the end, towards the peak of the first phase, when we put in place the measures that actually resulted in the numbers coming down. So what was it that we did? One, we have to go back in a really strong way to the test, trace, isolate, treat protocol that various state governments adopted with great success. This also included creating containment zones, making sure that people adhere to all social distancing requirements and other things, which I'm coming to, which is the second thing. These are called NPIs, non-pharmaceutical interventions. We will have to make sure that people wear masks. We will have to make sure that everyone is socially distanced. We should definitely not allow mass events. So large religious gatherings, large political rallies, large weddings, people having parties with 40 people or 50 people, none of birthday celebrations, none of this, or religious functions or festivals. There've been a spate of videos that we've seen, right? I mean, whether it's from Andhra Pradesh, where people are throwing things at each other to celebrate the New Year, or the Kumbh, where you have millions of people, or Mecca Masjid in Hyderabad, where again there are countless people. And I think everyone's being rather foolish, because the most important thing is health. And it's not just your health, it's the health of those around you, it's the health of the economy, it's the health of the country. The government really needs to accelerate and expand its vaccine drive. I think that is something that would really help. We've made some good moves over the past week. We've approved more vaccines, or at least created an opportunity. We've approved one more vaccine, and we've created a guideline. We've put in place a policy where which makes it easier to bring in vaccines that already have international approvals by reputed regulators. So we should somehow increase our access to vaccines. We should increase availability of vaccines, and we should relax the fairly restrictive criteria that we have right now. The prevailing view among experts is once a city or a region starts putting in place non-pharmaceutical interventions, you start seeing results in anything between 3 and 6 weeks. Some of the experts I spoke to said 3, some said 6. I think by the middle of May, we should be all right. I would very much like us to be all right by the middle of May.